We've always had a strong ethos in terms of education in primary care in Tower Hamlets. It's embedded into our DNA, really. We learn together, and learning together helps us work together more effectively as a team. And part of the attraction of the CEPN was to learn together in a more coherent community of primary care. Development of the CEPN was always going to be challenging because it was a new way of approaching education. So instead of being in our traditional silo of primary care, in practice-based primary care, with practice-based teams, it involved more professionals across the whole of the primary care community. So working with other professionals such as pharmacists and podiatrists and opticians, as well as the traditional primary care teams that we might have known before, GPs, nurses, healthcare assistants, admin staff and managerial staff.
Well, there's lots of things going on with the practice nursing workforce in general practice settings. The main problem traditionally has been a large lack of practice nurses, which we have addressed in Tower Hamlets over a long period of time. But the way the CEPN has come in to address practice nursing issues is to really work hard at seeing if we can engage undergraduate nurses who are in training to come and look at what's happening in general practice. That's easier said than done because the general practice has to welcome them in and make sure that they have time and effort available to run that placement. So we've been trying to persuade practices, and it's been quite hard work because a lot of people have never done this before and they're quite nervous and they think it might take a lot of time and energy. So what we've done is we've set up a tutorial group for undergraduate nurses which takes them out of practice and gives them a really good background in primary care. And that's run by two of my team. I have a team of 4 extremely good, excellent, very senior nurses who are nurse practitioners with a lot of experience who work in education with me. And they have set up and run this tutorial system for undergraduate nurses, which has been great. From going from nothing, we've never done this before, never done anything like it, we've gone from nothing to actually really winning the approval and the sort of really been supporting us from a very cold start. By the end of the 6-week period, we've had undergraduate nurses who are now interested in going into general practice. We've got 2 children's nurses who wanted to become practice nurses, and that's just having heard lectures from practice nurses talking about primary care, medicine and care. The care homes has been a really interesting experiment. It's been a pilot project. When we first envisaged the CEPNs, one of the things that came to mind was a fantastic project down in Devon where 2 community nurses had gone into some care homes and done some work training which had had wonderful benefits, including things like reduction in hospital admissions, which is a very important aspect of it. We decided that we'd do things slightly differently. We knew the care home staff in nursing homes had quite a lot of training, but in residential care homes the problem is that they have very little training in any medical area, and the staff are dealing more and more with quite complex medical issues. So we decided that the sort of training that we give to our nurses and HCAs, we would adapt that to give to the care home staff in a very gentle and sort of bite-sized piece way. So again, 2 of my mentors have been leading on that, and they've done a fantastic job. The response from the care home staff has been really, really encouraging. They've given fantastic evaluations to the team that are running the training, and they've been so pleased with it, and one of them said it's been the best training they've ever had.
Pharmacy is the most accessible healthcare for local people. Over 500 people from Tower Hamlets visits a pharmacy each day. Apart from getting high quality medicines, they get lots of good advice from the community pharmacy. And pharmacists play an important role in improving people's health. With increasing pressure on GP surgeries, accident and emergency and social services, pharmacists are there to play to provide accessible, convenient and professional support to local people. Pharmacists in Tower Hamlets are innovative and are retraining the pharmacy team so they can provide a good service to local people. The training requires not only clinical training but training in behavioural change as well. Tower Hamlets CEPN has facilitated integrated training where people can come together, exchange good ideas and exchange good practice, and take those ideas and good practice forward into actual training for people in health and social care in Tower Hamlets CPN. We've organised health coach training in Tower Hamlets where different professionals can work alongside each other with the same kind of training and apply that training in their own context. For pharmacists, this has meant being able to offer healthcare advice and helping people change their own behaviours, especially for those on long-term conditions who want to take more control of their self-management of their conditions or take more of a self-care role in the management of their health conditions. We've also had a very successful health and social care level 3 diploma for healthcare assistants, staff in GP practices and counter-staff and pharmacists, where they've been able to take on new skills and new knowledge, working together and allow them to progress onto high-level courses if they so wish.
One of my colleagues and I from Public Health worked on the Healthy Life strand of the CPN project. The main aim of the work that we were doing was to engage with frontline staff across primary care settings as well as the wider stakeholders, including the voluntary sector, because obviously there is a recognition that they often have the first and the last contact with many of our patients. So we designed a project in 2 phases, and the hope was to explore what they're already doing in terms of meaningful conversations with our patients around making simple lifestyle changes, much in the making every contact count style, and to also see what gaps, if any, exist in that framework. So in the first phase, we had a participatory appraisal workshop, and very pleased to say that we had over 70 participants come to that. We used very engaging participatory appraisal tools like causal impact diagrams, timelines and mapping to get them to revisit their everyday roles and identify opportunities that might exist within those roles to actually carry out a little bit of health promotion. One of the highlights of that workshop was that we got participants to actually think about the one thing that they would change in their everyday practice as a result of the workshop that we carried out. Some of them said that they would smile at patients a lot more. They would engage with them more meaningfully, try to understand their perspective. But there was also a lot of recognition that they needed to understand wider services around them and to be able to better signpost people into those services. So that was the first phase. In the second phase, we looked at the learning and some of the pledges that the participants made at the participatory appraisal workshop to be able to tailor something that would meet their requirements. So we opted for the Royal Society for Public Health Level 2 Applied Award in Health Improvement. We had a smaller cohort of people going through this intensive training program, which takes about 2 days, and then it has a portfolio element which is very practical and very exciting. The training covers basic principles of health inequalities, wider determinants of health, and how they might have an impact on the patient that they're seeing within their practice or within their setting. And the portfolio element actually allows them to put all of that into practice. So it looks at things such as, can you tell us about health improvement services around you? How would you encourage patients to make contact with those services? It looks at basic goal setting and behavior change. So that was what the training was. Very pleased to say that 100% of our participants actually got a very high score on the Applied Award, and they're still working on their portfolios as we speak. I think one of the good things that have come out from this training is the multi-organisational work that we've achieved. So new relationships have been forged between primary care and the wider health system around them, which hopefully means that we will have a more integrated and holistic care pathway for the patients and better health outcomes. I think what my vision for this project is that frontline workers can actually recognise the important role that they have to play in improving the health of the population that they serve.
I think initially one of the main challenges was the short deadline that we had and recurring short deadlines, and that meant that everybody had to sort of get together at short notice, which was difficult to arrange, sometimes in the evening, and I think that leads on to sort of one of the other challenges, which is the capacity of the clinicians and everyone involved to provide this sustained leadership So that's one of the main issues is sustaining the time, providing the time needed to think clearly and plan properly. And another major challenge, I think, and something we all, really the main point of the CPEN is to work together across all the boundaries and working with colleagues in different professions. And each profession has its own restrictions, and perhaps they've got their own systems for development of education, and it can be very hard to bring these people together. I would say we're making good progress, but there's still quite a lot to do. We've got good links with pharmacy, but we're having more trouble making links with dentists, for example. Well, when we started off, we had lots of ideas, and we jumped in with both feet. But I think a very important thing is to try to do things that are achievable and do them well, rather than try and do too much at once. Also, try and arrange an event that will attract people from all professions. We recently did this with an event on safeguarding adults. And we had people from mental health, social care, and nursing and primary care. And we had very interesting discussions, and it was full and well attended, so that was satisfying. But the most important thing perhaps is the time needed to create good relationships, and especially when you're going into new territory. And we've got this wonderful plan which has started to start giving development and education in care homes. They haven't had anything in the past, so even the concept of education is a difficult one to overcome. So you need time to build relationships.
For me, the CPEN will provide education for the whole primary care workforce, so skilling up the whole primary care workforce to deliver care in a better and more coherent fashion for our patients. It's keeping our patients at the centre of care and skilling up the workforce to enable us to deliver that. So I would see us as learning together much more in terms of and breaking down barriers across professions, whether that's within professions such as doctors from primary and secondary care learning together, or nurses from primary care, secondary care, community care working together, or within professional groups as a whole. So in terms of the integrated care and coordinated care agendas, then I think we're going to work much more effectively together if we actually learn together as a starting point.